Welcome everybody to this session. And I'm in the next couple of hours, I'm just going to talk to you about how to study the right way for MRCOG Part 3. A little word about why this session was needed and why I organized this session. In the present times, the stakes are really high for this exam. It's difficult to secure a seat in the exam, and theoretical knowledge is rusting away particularly if you have done your part 2 a while back, because there has been a long gap in the exams due to pandemic. And even if you have sat an exam recently, then once again you are back to the point that after being unsuccessful one time, then securing seat for the next time is going to be a bit tricky. Most courses do not include a proper training for the skills and the attitudes that are assessed in the oral assessment exam. And if you are able to secure a seat after all that difficulty, then it's not really um, it's not really affordable to miss that chance only because of being underprepared for the exam. Moreover, exam fees are too high to be wasted on repeated failed trials. And still, there are a lot of uncertainties still going around for future exams, and online experience has its own challenges. So I thought that it would be a good idea to take you guys through a brief discussion about the understanding of how you need to prepare for this exam. So in the next couple of hours, what we are going to talk about is first of all, I'm going to talk to you about the difference between part 2 and 3, so that you understand that how is it different. The preparation for part 3 is different than for part 2 exam. We will discuss 5 rules to study smart. I will tell you how I can help you in this process, and then we will have Q's and A's and the panel discussion. I'm running this session with two main aims in my mind. First of all, I would like to help you to understand to study smart, the difference between study hard versus study smart to pass the exam. And the second one is to highlight the differences between part 2 and 3 preparation. That's where most of the people get stuck, and they do not understand why they are not finding it easy to prepare, or why they are repeatedly failing, because somewhere down the line they might be preparing just the same way they prepared for part 2. So to begin with, about the study hard versus study smart, you know, um, I just want to gather some thoughts. What do you think? How to study smart? There's a chat box function here. Please use that function. I will give 1 minute for people to type their thoughts. What do you think is, how can you study smart, and what could be the difference between study hard and study smart? So someone has said that knowing what is assessed in contrast to trying to cram everything, that's a very good understanding. So this means that you are not studying everything. You target your study according to what you need to study. Another thought has come that to study the right material, absolutely. There's no time to waste on studying what you want to study versus what is needed to study for the exam. Another thought has come up as organize the material required to study, analyze what is required and expected in the exam. Absolutely correct. To study the required stuff, exactly. Preparing for what the need of the exam is, to practice other than learn from others' mistakes. Very well done. It's a very good response to your understanding. I'm glad that most of you are with me on the same page. So study hard and study smart are very different. Study hard means that you are putting all your effort, you're putting your time, your resources and everything, but you are just studying whatever comes in front of you, or you're just preparing with all possible resources or whatever is in front of you. But study smart means that you first do a little workup about what the exam is going to assess. And the open secret to pass the exam is to give the examiner what they're looking for. So first of all, identify what the examiner is looking for, and then prepare and study accordingly. That will be study smart. So there are 5 rules that I personally follow to study smart. First of all, rule number 1 is this, which is the most important rule. Most of you have already pointed that out: to know precisely what you need to do. And the more detailed your vision, the better your chances for success are. Rule number 2 is you need to know the difference between training versus repetition. Yes, for the exam, we repeatedly practice the same thing over and over again. But then there is a difference between training yourself for the exam versus just repeating what you are doing constantly. Rule number 3 is to focus on taking small steps day by day and apply what you learn on real life patients. It is extremely important to bring the applied clinical knowledge domain out of you. Rule number 4 is to approach your goal using one path. And rule number 5 is to determine your starting point, to identify what you need to do, because you need to stop comparing yourself with anybody else. Everyone has a different need, and you need to identify your needs and then address your needs. So we will go through these rules one by one in more detail now. With regards to exam requirements, you really need to know what the exam is requiring. Now, the main challenge that part 3 people actually struggle from is that they have either recently done part 2, or they have not done another Western oral assessment exam. So they really remain in a limbo. They don't understand what exactly needs to be done to pass the oral assessment exam. And that's why you need to be very clearly aware about the difference between part 2 and 3. Once again, I would encourage you to think a little bit about what is your understanding about the 2 parts, and that will take us further in seeing how the way you study will be different. I will give 1 minute for this brainstorming, please. Part 2 tests the knowledge. Yes, I'm reading the comments in the chat box. Um, getting all clinical, it's getting a bit, getting all clinical knowledge for part 2. Part 2 is knowledge, and part 3 is applied clinical knowledge and communication. Part 2 is more about theory, and part 3 is particularly dealing with patients. Um, part 3 is testing applied knowledge. Part 3 is how to apply and communicate the knowledge. Absolutely, most of these thoughts are absolutely correct. I would like to further emphasize on these thoughts by giving you a picture about a clear understanding about how the exams are designed and developed, and how basically your competencies through the different parts are assessed. So basically, this is the Miller's prism of clinical competence, and all exams, they follow all curriculum, all syllabus, and all exams. They basically follow this prism. It's like a very important thing in medical education. If you look at this closely, um, to the prism only itself, so this part, if you go to the RCOG website and read what RCOG exams is, it tells you, the first sentence it says is that this is an exam of your knowledge, skills, and attitudes. So you can see right away that the Miller's prism is what is actually tested in this exam, is used in this exam as well. In this further, the knows and knows how, these are the 2 levels. So the first level of your learning, of your competence, is the knowledge. You establish the knowledge. Part 1 covers only the knows. You just have the simple questions which are scenario based, and they just check your factual knowledge. But when you move on to part 2, then you have your knows and knows how. Knows is covered in the SPAs, and knows how is covered in the EMQs. That helps you to work through a clinical scenario, and then you develop an understanding and you choose an answer. Whereas the further 2 levels, which is shows and does, this level of the prism is what comprises of part 2. Another important difference to understand is that your part 3, does and shows is for the part 3. So another important thing to understand is part 3 is the exam of your behavior, whereas part 2 is the exam of your cognition. So there are fundamental differences between these two exams, and unless you understand these differences and prepare accordingly, you are likely to have a little hard time to get where you want to get. So basically, from novice to expert through the process of part 1, 2, 3, it's like a spiral learning curve. And this learning curve is basically divided in 4 domains in all parts of the exam. The modules remain the same. We have 14 core modules for all parts, but the domains that are assessed in those modules are different for each part. So in part 1, the domains are completely different, as you can see written here. In part 2, the domains, there's another set of 4 domains, and in part 3, another set of 4 domains. So in total, there are 12 domains that are assessed through this spiral learning curve that they assess you from being novice to become an expert, and that is where you achieve the highest level of competence, which when you actually start doing those things. And of course, that's where we all want to go, but mostly we focus on the moment of glory so much that we forget the process, and we just want to get the victory, the success, without understanding that what is the process that will lead us to that victory. Now, the main differences in the domains of part 2 and part 3. So part 2 has these 4 domains: diagnosis, investigation, management, epidemiology, and part 3 has applied clinical knowledge, the patient safety, information gathering, and communication. Now, these 4 domains of part 2, they aggregate and they just form one domain of part 3, which is applied clinical knowledge. So if you put a lot of time in reading guidelines, then you are just focusing on one domain of this exam. So you really don't need to read the guidelines for part 3. Even if you have set the part 2 for a long time, there is another way to go about that, but you do not read the guidelines the way you have read those guidelines or strategy topics or the TOG articles. The way you did for part 2, because that way you are wasting your time into just one domain. The remaining 3 domains here, they are more important, and they have their own ways. So part 2 domains, they assess your cognition, and part 3 domains, they are designed to assess your behavior. And even these 4 cognitive things, they must translate into your behavior, so that you can show the examiner how you will apply this knowledge of diagnosis, of investigation, of management, and epidemiology to a patient sitting in front of you. So this is something to understand, and then we will look at this further with an example. So let's take an example of this 29 years old. This is a scenario that can appear for part 2 or for part 3, both exams at the same time. So 29 years old, para 0 plus 2, that presents with lower abdominal pain and bleeding per vaginum. Her LMP was 5 weeks ago. Beta HCG result is 1,250, and ultrasound scan doesn't show any intra or extrauterine pregnancy. So we do know that the question is about it's a pregnancy of unknown location, but what questions can you expect? That's the important thing to understand. That what the examiner wants from you is what you need to give to the examiner. So you need to understand that how this differs from the same question for part 2. If it comes as an SPA, the question will be directed to cover only one of the 4 domains. The question would be either diagnosis or investigation or management or epidemiology. If it is the EMQ, then the question will be diagnosis, management, and investigation. Epidemiology goes out of it. But this scenario will only come down to one domain. Whereas the same scenario, when it comes for part 3, first of all, you will have to deliver these results to the patient. Then you will have to explain the diagnosis to the patient. After that, of course, patient will have some concerns that you need to address. After addressing her, in order to address her concerns, you will need to gather information from the patient, and then you will be able to develop a shared care plan. And you also need to involve other team members. You won't be doing everything yourself. This all will form applied clinical knowledge, information gathering domain. Patient safety will automatically be covered in all of these things, and you can't do it without a good communication. So you can see that all of the scenario remains the same, but the approach is completely different. So that brings me to talk about the study strategies, how they are different for both parts, and I would just like to take you through how they are different. So a quick comparison for part 2 exam. I will not touch this in a lot of detail, but just for your information, that in order to achieve competence in know and know how, you need the best technique that works is SQ3R technique. I'm going to talk about it briefly in a while. And for part 3, the technique that you need to use is the transfer of learning technique, so that you can show and do what you know and you know how. So this is the SQ3R technique. First of all, what happens is that I'm not going to spend a lot of time on this slide because it's more relevant to part 2. But if you see here, the main thing is that you read, you recite, and you revise, and you repeat this process over and over again. When you do this over and over again, so what happens with this learning technique? How does it work? You first of all, with this process, you gradually when you read once, you forget thing. You read twice, you remember a bit, but still you forget. Then repeated revisions. Eventually, what happens is that information transfers into your long-term memory. So this is now different with transfer of learning technique. Now, with the part 2 exam, you already have the information in your long-term memory that you have done by repeatedly reading the same text, same guidelines, same talk articles. What you need to do now for part 3 is to transfer that learning now to the part 3, to the domains that are, you need to translate that knowledge into the domains of part 3. And because that is your cognition, and you need to now make it a behavior and show the examiner your behavior, not the cognition. Cognition is already tested. You have passed that level. That's why you're sitting part 3. So you need to move on from there. And for how will you show your behaviors to the examiner? Through these 4 domains of communication, applied clinical knowledge, information gathering, safety and quality. And of course, all of this will be coming from your long-term memory for the part 2 as well. So simple message is that you have to move forward from that pattern of studying, and you need to do something different in order to pass the part 3 in the first attempt. This is a little bit of further elaboration about learning of the skills for the part 3 exam. As you can see in this graph, there is a high risk of transfer failure, low risk of transfer failure, and then there is an optimal transfer. So this is basically a stepwise approach, how it happens, how the transfer of learning actually happens. First of all, you need to make an intention to transfer. You need to understand that what you have learned in part 2 now needs to be transferred to part 3 in a different way, not exactly the same way. Then you initiate the process of doing that by developing more understanding of what you need to do. You gather information, you get on some courses, and you start doing those things. So with all those processes, whatever the input you make, you do develop a partial transfer. Of course, there is it won't happen overnight. Behaviors are learned over a period of time. The minimum time period that you need to develop a new behavior is 3 weeks. You need to do something consistently every single day in the same manner for 21 days in continuity to develop that as a reflex behavior. And that's exactly what we want to do over here. So when you initiate the process, slowly, gradually, partial transfer takes place. So you can see that you are getting more in the green zone now. You are becoming low risk for failure in this exam. And then you reach a point, but after partial transfer, you need reach a point where you understand all of the things that needed to be transferred, and then you make an effort consciously to maintain that transfer. When you reach the level of conscious maintenance, that is a good point. But then what we want to achieve here is an unconscious maintenance, which is a reflex behavior. You do those things just naturally, just in a flow, which means that when you are sitting in the exam in front of the role player, you actually just deal with the role player as your real life patient, and you carry out the consultation just reflexly as if you are doing in your real life. That is the optimal transfer. nobody can expect, it's impossible to fail if you have reached the unconscious maintenance level. And this is why I always recommend that for part 3 examination, the best approach is to apply those things in your day-to-day life so that you quickly reach the level of unconscious maintenance. This is acceptable transfer. You remain in the borderline. You don't know, you may pass the exam, you may not pass the exam. You would be very lucky if you actually pass all 14 tasks. But then what happens with partial transfer and conscious maintenance is that you do, flunk in one or two domains and you pass other couple of domains. That's where the slippery slope is. So you need to be very well aware that your aim should be to maintain whatever transfer of learning has happened, maintain it unconsciously. Now, putting it into the part 3 practice, basically how this was a theoretical concept for you, but how it happens. You First of all, for part 3 exam, you know what to do. So you develop an understanding about the exam and you start knowing what you need to do. Then you start doing it, which means that you start practicing the scenarios with your friends, with your, whoever you want. Then you receive feedback. Whatever you do, somebody gives you a feedback, tells you how did you do, what needs to be improved in that. Then you redo after that feedback. And then eventually you reach a level where you are able to reflect on what you are doing, and you are yourself, you become very well aware of your deficiencies, because you are reaching close to the unconscious maintenance, and you can reflect yourself without the need of somebody else feeding you back. This level of reflection, when you reach the level of self-reflection and you're able to look into your own flaws, you identify where things are going wrong and what do you need to do differently to achieve better results. That is the level when you actually are independent. You reach an independent competency level and you can do things. Things will always go wrong. You will always make mistakes. We are human, and to err is human. So it's not that you will be flawless, but at least you will be able to do things independently. So in part 3 exam, sitting in front of the examiner, you should be able to show your reflective behavior, whatever you are doing. For example, if a mistake has happened, a patient is angry because something went wrong, she had lost her baby or she had a hysterectomy during cesarean section. The whole idea is that you should not go down the route of the theoretical knowledge and start telling her all the the reasons and whatever for that. You should be able to reflect on that incident, and you should be able to show the examiner that you know that when you do things, things will go wrong, but you are at that level of learning where you can look back at what you have done and you can reflect back on that to improve your learning. And that is the level that you need to achieve for part 3 in order to get the success in this exam. Now we will go on to, may I please request all my microphones to be mute, please? Now we will go on to the next rule about training versus repetition. This is a very important section to please pay attention to. How to make a conscious choice, because we need to decide what are we going to do for this exam and how are we going to prepare. I would like to ask you one question. What do you think happen? People do pass, even if you don't go through a proper training for, in the UK, you don't do any, attachments here, or you're not working in the UK. You may flunk a couple of times in the exam, but eventually you will pass. I just want you to, after the briefing that we have just done, what do you think? Why do you, despite not having training and despite not really reaching the reflective level of learning or not applying the reflective practice and doing all those things, why do you think people pass after a couple of attempts? Your thoughts, please, in the chat box. All right, so someone has said that repeated clinical exposure to the patients applying in the clinic. So my question is that repeated failure in the exam, how does that make you pass? Eventually, you will pass. Very few people won't pass. So thoughts are coming up now. Someone has said that they found out through experience of failing. Very good. They correct their mistakes with each attempt. Yes, very good. They manage to learn what the examiner wants. Yes, exactly. By repeating things, it becomes second nature. Yeah, the reflex behavior forms that way. Exposure to examination and reading, practicing again and again makes them better. Repetition, yeah. Then reflection, yes, of course, when you fail, you actually unconsciously, subconsciously, you do look back, you do keep on thinking what went wrong, where did I go wrong, and why did that happen. So yeah, you do reach a level of reflection. Subconsciously manage to learn from mistakes and better guidance. Repetition of exam is like rehearsal. All right, thank you very much for your thoughts. So basically what happens with repeated exams or repeated failures is that the you for the part 2 exam, what happens is that when you read and reread the same things over and over again, it goes into your long-term memory. Each time you learn something new that you did not do in the last exam, and you gradually reach that level. And this long-term memory, of course, for part 3, it's something different. For part 3, once again, this long-term memory you will be using in part 3, but then gradually when you fail multiple times or more than once, you do figure out, and actually you reach the level of reflection, and you subconsciously, not knowingly, you all are very smart people. Of course, sitting for MRCOG exam in itself is not a joke. It's one of the most difficult exams, most difficult membership exams. So you all are very, very smart people, and you should never doubt your capabilities. The only reason why you might be failing is because you are not understanding the requirements and you're not getting what you need to do. So being smart people, you do reflect. We all reflect, and that's why for the part 3 you do understand. And what happens through this process of reflection and recurrent failure is that first of all you master the cognition, and then you develop a behavior, because you do learn that I did this mistake last time, I won't repeat it again. And then the process, naturally the process from the transfer of knowledge from long-term memory to part 3 starts to happen. So um, it's your choice really. Would you want to do this by repeated failures, or would you want to practice, uh, would you want to train yourself? So training versus repetition, that's your choice. Do you want to train yourself the first time and the right way, versus do you want to keep repeating and then you learn subconsciously, and then you still don't know that what did you do differently for a different result, you just pass and you happen to pass. So the choice is really yours. Once again, a recap about the differences between part 2 versus part 3. Domains are different. We have already spoken about that. The questions are different. For part 2, each question focuses only on one domain, whereas on each task for part 3, you have to cover all domains. Competency is different. Part 2 is know and know how, and part 3 is show and do. Technique for preparation is different. We have spoken about it in great length. You need to focus on the transfer of learning from your part 2 to part 3, and then your learning needs are really different. So with the repeated revisions, the transfer happens from short-term memory to long-term memory, whereas in this part, you already have those things in the long-term memory. Please don't waste your time going and repeating that information again. You will need to revise the guidelines, or you will need to revise those things, but in a completely different manner, so that you can transfer the cognition into behavior, and then you can show that to the examiner. Rule number 3 is apply what you learn. And this is simple, very simple rule. Take some small steps every day. You cannot expect to learn all of this. Like I said, behaviors take up to 3 days, 3 weeks, 21 days to develop, which means that every day you need to make a conscious choice of adding something new to your behavior. And then you need to do it consistently every day, so that that becomes second nature. What you can do very easily is, of course, all these domains in your daily life you can apply to the patient. And my suggestion for that, how you can do these things for the communication with your patients, apply consultation model. When you see your patients, use the consultation model, so that in the exam you are not trying to remember under the stress of the exam, you anyway can't remember things. You start doing things reflexly. That's why you need to develop a reflex. So start seeing every single patient by applying consultation model. It will take time. You don't expect yourself to be starting the full consultation model right away tomorrow. If that is something new for you, start by introduction, then going on agenda setting, then going on information gathering. So small chunks every day. And whenever you communicate with any colleague, use SPAR technique so that this will become a second nature. When you are talking about the applied clinical knowledge, develop your understanding of the module mindset, understand what each module is covering, why, what they are going to assess. Please shift your focus from topics to modules. One topic can be covered in several modules, but that module will be assessing you for certain things. Every module assesses you for a certain thing, because of which my courses are mainly focused on module mindset, and that helps you to understand how the same topic will require a different type of conversation or a different type of content to be covered based on the module. So please develop and then apply module mindset also on your daily patients. Same problem, for example, if you're seeing a breach, then make sure that you are consciously aware of how your consultation is going to be different if you're seeing that breach presentation in the antenatal clinic versus if the breach presentation has come in active labor, versus so that let's say that the active labor breach is undiagnosed breach, how that consultation or what that consultation is going to cover, versus if it is a footling breach, versus if you are there for the consent to take with breach presentation. So simple thing, breach is one topic. The content for based on the module is going to be very different for the same topic. So you need to shift your focus from topics to the module mindset. And focused information gathering is only possible when you apply the mindset. We have very little time. You already know that time management is the biggest challenge for most of the people, and that happens because we are all over the place. We are asking all the questions on earth without having a proper focus of that information gathering. So also, first of all, use the module mindset to develop a focus of your information gathering. And also the other thing to make it possible within 10 minutes is to understand the difference of gathering information when you are talking to a stable patient versus an acutely unwell patient versus a collapsed, when the scenario has a collapsed patient. You can't bypass and as well as if you are, it's a structured discussion with the examiner. Sometimes a lot of information is already given in the scenario, and then you're stuck that what do I need to do now in the information gathering. Sometimes you think that in the question information gathering is not asked. They have not asked you specifically to gather information, and then you feel that maybe I need to miss that. But please understand that you cannot devise a management plan without gathering proper information from the patient, and that is directly going to affect your safety domain. If you miss information, some specific information, then you are going to fail the safety domain as well, and the information gathering domain, and the applied clinical knowledge domain. So all of this are interlinked. At the end of the day, in a consultation, all your domains are going to be interlinked. And lastly, for patient safety, you need to familiarize yourself with clinical governance. It is something which is very different in this country as compared to other countries. Clinical governance is nothing but just safety and quality. And this is done in, this is the most important component in this country. You really have to develop this understanding. So how you can apply this thing, we are talking about the rule of applying it. Every place, yes, the systems where you might be working may not be the same as in the NHS, but every place do have some systems in place. So what you can do in order to apply is to understand what systems are applied in NHS, and then look for those systems in your place. So that is just going to help you to understand that every place has those systems. For example, let's say that you have a patient who complained about something. Then you can simply see that how things happen in your hospital, what are the complaint procedures and processes in your hospital, versus in your reflective times, in your own times, just have a look at the process that happens in the NHS and see what the difference are. Our brains pick up the differences far more quickly than the similarities. Mostly the similarities are actually a lot, differences are a few, and it is easy to pick up the difference. So if you have no chance to work in this system, the best you can do is to compare it with your system and pick the differences, and then focus and consciously remind yourself that this is what you need to develop and do in the exam, because that is what will be expected in the UK system. Now, rule number 4 is use one path. This is a very important thing. Putting your leg into 2 different boats at the same time is a very dangerous technique. Yes, you can be lucky to pass. It could mean that you are sitting for 2 different exams at the same time simultaneously, or it could also mean that you are using multiple techniques or multiple resources, multiple advices to do your best. These, yes, they do sound as if it's a good idea, but it actually is not a good idea. You need to, before you start your preparation, you need to spend some time in understanding the requirements of the exam, all the previous rules that we have said so far. Do a survey, find out what suits you best and what meet your needs. Choose one path and then stick to that. You all are adults, you can make your choices, you have the ability to differentiate between right and wrong, between whatever. So you need to identify your path and then stick to that one path, because if you keep on going on 2 boats, then eventually one of them is going to, you will lose the track, and of course the outcome is not what we desire. And the last rule is address your needs. You need to determine your starting point. Everyone sitting in this meeting today has a different starting point. Nobody is right or wrong. There is no right or wrong choices about things. It's just about your starting point. That depends on where you are working, what have you done so far, what is your clinical experience, how good you already are in communication. Did you receive any communication skills training specifically till this point? Have you ever had any experience in working in a setting which is very similar to NHS? So many things. And besides that, there is a personal life. We all have a personal life, and we all are at various stages in our personal lives. Not everybody would have an ideal situation to sit in the exam. There may be, with this pandemic, of course, illnesses could be going on. You may be moving homes, you may be moving countries, you may be going through some relationship difficulties, you may be having your children busy in their exams, you may be having to take care of an unwell family member, you may be unwell yourself, you may have mental health problems, you may be depressed, there could be so many reasons. So please don't compare yourself with anyone else. Shift your focus to your needs. Identify your needs and then address your needs, because that is the most important thing. To determine your starting point, you need to understand that there are 3 domains of learning. One is the cognitive domain. This is the these are the 3 domains of learning, which are you will also find in strategy and RCOG website. And all of these domains of learning, it's always a process. You just immediately can't jump on the top. Of course, for part 3 exam, most importantly, we need to reach the top of the cone of all these behavior, things. You need to understand where you are in your cognitive domain, where you are in your affective domain, and where you are in your psychomotor domain. So psychomotor domain is learning of skills, affective domain is the learning of attitudes, and cognitive domain is the learning of knowledge. So you need to identify your level in each of these learning domains, so that you can then figure out what do you need to do to progress to the next level. So some very common questions related to MRCOG Part 3 exam. I have answered quite a few within this, but some of them time management. As you might have figured out, the time management requires module mindset, understanding of the healthcare systems, you being very familiar with using the consultation model, having the right communication skills to talk to the examiner or the consultant or to another colleague or to the patient. All of these, time management will not happen automatically. There is a whole process of the transfer of learning behind time management. So you will be able to manage your time when you reach the unconscious maintenance level and the reflective learning level, because even for time management, nobody can help you except yourself in order to how to best manage your time and how. So you will need to do a lot of reflective learning. You need to reach the level of unconscious maintenance of your transfer of learning. Then people do find, some people have difficulty with different domains. You need to identify which domain is particularly your challenge. And please understand that although you may have failed or you may be finding one particular domain difficult, at the end of the day, all of the domains are interconnected in the exam. It just happens that you have particular needs in one domain. So my advice is that please, when you are focusing on developing one domain, never ever become overconfident about a domain. That, for example, if I believe that I'm good in communication, but I have some weaknesses in safety, I may have the tendency that I will work too much on the clinical governance matters, that I will in the exam will be so stressed to do the safety domain so good that I will compromise inadvertently with my communication, because that will be it will give me a tunnel vision to, it will be just pulling me on one side. You need to keep a balance of all domains. So yes, you may have some weak domains, but please do not ignore or neglect those domains that you think that are strong. You need to have a balance of all domains on every single task in this exam. Another very common question is that in the exam there are sometimes long instructions with the scenario. So, of course, in 2 minutes, my recommendation always is that when you're reading the scenario in the first 2 minutes, the first thing you need to do is to decode the scenario, which means you need to identify what module it is and what exactly do you need to do. And then after decoding the scenario, you give yourself some time to prepare yourself before you go inside the station. So there's a lot to do in 2 minutes. The biggest mistake is to spend those 2 minutes just reading all those instructions. That is not what you need to do. You need some technique to deal with those 2 minutes. I emphasize a lot on these techniques, but a quick overview and a quick understanding for you. So you need to know these three things. You need to know in that long text that you have, what can you ignore? What is it that where you have to speed read, which means that you don't really need to read it word by word. You can just quickly use the speed reading technique, which is a proper technique actually. And then which is the area where you actually need to pay attention and decode the scenario and pay your maximum time. So this is how, let's say, a scenario comes, and then attached with the scenario are sometimes some instructions. Just excuse me, please. Yeah. So a scenario, and then scenario is usually more or less the same. There are additional pages, additional instructions. Sometimes the scenario can be longer. So this part, assessment of the domains, ignore that completely. You really don't need to read that. We know what domains are being assessed in this exam. The upper part, if it's a GP letter, upper part of the detailed information, unless you are given a task to critically appraise that letter, you really don't need this information. You don't need to know the name of the GPs or their qualifications or whatever. This part, where some investigation results or something is given to you, you need to speed read that. You really don't need to spend a lot of time, because there could be sometimes, if, like, for example, if there's an ultrasound report, there could be a detailed ultrasound report with a conclusion in the end. So I would actually skip everything and I will just simply read the last impression or the conclusion. Or if there is a set of investigations, let's say the blood results, there is an ultrasound as well, there is some beta HCG, there's some urine results as well, then you need to quickly speed read and just look at the most important things depending on the the scenario that you have. Now, this part is important, the initial part where they tell you the setting. Basically, this is giving you an idea. In this one, you are an ST5 working in a busy gynae clinic. You really need to understand the background, the setting where you are. Is it an emergency setting? Is it a clinic setting? This makes a lot of difference to your communication, to your information gathering, and most importantly, to how you are going to start the scenario. Let's say that in this section, they might be giving you some hint about that the patient has been waiting for a while, and that's it. And then so if you don't pay attention, if you are not paying attention with the mindset of setting, then you will miss. If I am paying attention that this patient has been waiting for a long time, immediately my communication domain, I will check that, and I will make in my prep time, I will note that I have to begin by apologizing this patient for the wait time. So this is a proactive risk management, which means that you prevent a problem from happening. Because otherwise, if you ignore that part, you go in and you start with a hello and introduction, and you go on, the patient will then start yelling at you that I have been waiting for this long, and all you need to do, and that is going to waste your time. That is going to lead to one into another problem, especially in the exam. So this is why it is a proactive risk management part, to understand the setting. Let's say that here there is a hint that the patient is waiting, is expecting to see the consultant. That's it. So when I go in, I will introduce myself with the level of my training, and I will give a reason why I am seeing the patient instead of the doctor, the consultant. So pay attention to the setting, because it is directly going to affect your communication, as well as the time management will be affected by that. And then the letter or the clinical information that you have. This is an important part. In this important part, you need to identify the keywords. Every scenario has, or a question has, these things: some keywords, some action words, some limiting words. And this also applies to the questions that are written in the end. So you need to keywords. Let's say that it is the topic, whatever the topic is under discussion. Action words are that will give you the idea about the module mindset, which module it is. It will be telling you what to do in that. And then limiting words will be giving you the scope of that consultation, so that you don't just speak about everything in that topic. That will tell you what exactly do you need to cover in this one, and then you need to identify this. So you need to pay attention. This is what I call decoding the scenario. Decoding the scenario helps you to read the scenario carefully, strategically, and then you identify all of these things. And if you do it right, trust me, you can read the scenario very nicely within 1 minute. After you have figured out these things, the next thing to do is to quickly speed read. You don't even need to read all the additional instructions, or there could be case notes, there could be some leaflets, there could be some information, further information, whatever is available over there. You really don't need to read all of those things. But what you need to do is to speed read them, which means that you quickly glance them with a zigzag fashion very quickly, mainly noticing the headings or the subheadings in that, just to have an idea about the content, because those instructions are what you are going to use inside the scenario while you are communicating with the patient. You will have access to those and you can refer to those. But if you miss on this part, then you are unlikely to perform the scenario correctly. So yeah, now with regards to the Osler system, we are going to talk about it with our panel. Hopefully the recently passed people will help you a lot about understanding the Osler system. So please stay with us till we reach that point. Now, another question is, where did I go wrong? Many people, as you must have seen in the group as well, that they thought that they did quite well, but they were unable to figure out where did they go wrong. I hope that all this talk that we have had so far would have provoked some thought of thinking processes in you, and you may be able to reflect back and identify where you actually did go wrong. It's not an easy question to answer for anybody else. It's only you who can actually do the reflection and figure this out.